feel when you get up in the morning? For me, there's always that moment of mixed feelings like sadness and hope. Now, I am not a doctor, but so many people around me have gotten sick recently. So many people I don't even know have lost their jobs. And I often ask myself, when will this pandemic finally end? I knew that COVID-19 would be terrible early in 2020. A friend of my friend died in February after getting off of one of the Princess cruise liners. Then I watched death shadowing Italy, where my family is from, then Europe, and then it hit America. As of November 18th, 2020, the world has lost over 1.3 million people, with the total cases of over 56 million. Now you may wonder, can this get any worse? If you ask me, the unfortunate answer is yes. Living here in San Diego, miles away from the Mexican border, I can't help but notice how bad the numbers are in Mexico. Mexico lost 99,026 lives out of 1,011,153 people infected. That's 9.79%. But why is it? Is that because it lacks resources to care for the sick? Although I cannot say this is the reason, I am sure it is one of the factors. However, this number is way too high, even when it is compared with other developing countries. Or possibly, is it because the government refused to conduct more tests? Mexico tested only 2% of its population, while some may point to Haiti to dispute low test rate as the reason for Mexico's plight. Haiti tested only 2,887 people out of every 1 million, while Mexico tested 20,277 people for every million. Now, Haiti is also short on resources. So why doesn't Haiti suffer like Mexico? Because Haiti did not have a Mexico-like outbreak. When you have an outbreak, you must do more testing. If you don't, then the virus is going to spread like wildfire. The Mexican president blamed the high death rate on population with chronic disease. For example, 40% of adult Mexicans are overweight, while 10% of the population suffer from diabetes. Combining that with the lack of public health education early on, no mask mandate, no quarantine in place, the virus overtook many communities before something could be done to stop it. Mexico has a national healthcare system which was started back in January 1st, 2020. But that did not do much to allow the wave of deaths to slow down. Like everywhere else in the world, hospitals are not ready to face ill patients to these numbers. According to Mexico's National Epidemiological Oversight Database, as of August 14, 2020, only 20% of all COVID patients who died actually received ventilator treatment. No ventilator? It's like drifting out sea without a lifeboat. But even for the few who got ventilators, 74% of them were obese and 76% were diabetic patients, and they ended up dying. Many young people don't think they need to worry about coronavirus, but 44.5% of all deceased in Mexico are younger than 61 years of age. That's 28,419 people as of September 1st, 2020. A popular publication recently wrote, and I quote, "In Mexico, patients who are relatively young and healthy are dying because public hospitals are failing to provide effective treatment." Although the president assured viewers and readers that there are beds and ventilators available in hospitals, he encouraged citizens to fight the virus at home. Many fought, many did fight, and they died at home and never made it as an official case or a death in the overall count. Now, maybe that is why the number looks so alarming. The case may actually be 10 times worse than is reported. But there is hope. There is definitely hope. A vaccine that can end this awful nightmare. Virus is an invisible enemy. Before the vaccine is out, you are pretty much on your own. Our immune system usually can take care of us, but coronavirus is deadly and it's dangerous. No vaccine exists for preventing a coronavirus infection in humans. Now, as of October 2020, there were 321 vaccine candidates in development worldwide. 56 vaccine candidates were in clinical research, namely 41 of them in phase 1 and 2. That's the trial phase. And then 15 of them in the trial phase 2 to 3. Although an infectious disease vaccine has never before been produced in less than several years, 2 of the top USA contenders have announced promising results with 90% and 95% effectiveness. Maybe the light is indeed at the end of the proverbial tunnel. I don't know enough to tell you the specifics on these projects, but I can share with what I know. Recently, one friend asked me, why are people so excited about a 90% effective vaccine? After all, with 600,000 a day in confirmed cases, doesn't that mean we'd have 60,000 new cases every day if we all took that vaccine? Actually, a vaccine with 70% effectiveness would provide enough herd immunity to stop this terrible pandemic. The virus cannot jump from person to person because most of us are immune. So 90% is better than what we can hope for. On the other hand, people may find the 90 to 95% success rate just a trick to boost the pharmaceutical company's stock. Usually profit is all they care about, right? But now their lives are depending on this cure also. I would not be surprised if that extra incentive did the trick. According to the Coalition for Epidemic Preparedness Innovations, most technology companies used new approaches in COVID-19 vaccine in the development of that vaccine because traditional vaccine methods failed to find a vaccine for coronavirus, for MERS, and SARS. Candidates in clinical trials as of September are focused on the coronavirus spike problem and its variants as the primary antigen of COVID-19. They have the platforms that are being developed in 2020, which involve nucleic acid technologies, RNA and DNA, one replicating viral vectors, peptides, recombinant proteins, and live attenuated viruses and inactivated viruses. Many vaccine technologies being developed for COVID-19 are not like vaccines already in use to prevent influenza, but rather are using next generation strategies for precision on COVID-19 infection mechanisms. Vaccine platforms in development may improve flexibility for antigen manipulation and effectiveness for targeting mechanisms of COVID-19 infections. Now you may say, I don't care how the vaccine is made, I just need to know that it works and if there are any risks. Well, I can't say how effective nor how safe these vaccines are going to be till they're ready to roll out. But I am here to tell you that there is no sure thing in the world. The question you should ask is if it is worth the risk. You may also say that my expertise is not risk assessment. My goal here is to stay alive and to stay healthy. Will getting COVID-19 vaccine give me COVID-19? That's a good question, but my answer is not likely, especially if your vaccine uses these new platforms. If the vaccine was not made with virus, how can you get a virus from it? Of course, it does not mean it will work for you. But if things get tough, we must get together and try. Who says we can't take our chance on a vaccine we don't know? But you may ask, is it true that if my immune system can take care of me, I don't need to take care of the vaccine? Let me answer that by asking you, how much do you know about your immune system? Another question, why did so many NFL, NBA, and Major League Baseball players get sick? What happened to their immune systems? Then you may say, how often do I need to take the vaccine? Well, if we can vaccinate enough people to reach herd immunity, then we are all home free after we stop the pandemic. But if we have an around-the-clock pandemic, you may have to get shots once every 6 months. But if that keeps you and the world safe, isn't that a small price to pay? I know it is hard to tell you to trust a vaccine that was developed under these mounting pressures without the years of testing and known to be not 100% effective. But let me ask you, what choices do we now have? Virus, the invisible enemy, is very small. You cannot see it, but it can kill millions and bring down powerful presidents on earth. And I mean President Trump and Franklin Delano Roosevelt. About 500,000 people died of polio worldwide back in its peak of 1940 through 1950. But it was stopped when Salk vaccine was introduced in 1955. I watched a story on that around 1995 when Salk died. The image of him was vividly imprinted in my mind because he actually refused to patent the Salk vaccine. Although he grew up poor and he did not want to get rich over people suffering, he said, "Can you patent the sun?" He felt his invention should belong to the world. And then 2 years later, Dr. Sabins invented oral polio vaccine. He also refused patent and profit. Because of them, we won the war against the polio virus. Can we win now? We can win if we are all on the same side. You and me. Let's do all that we can for a better tomorrow. Okay?